Nick Chamberlain is the CEO of the Northland DHB and joins me now. The Health Minister has said that launching a vaccination program at this time of the school year is going to have some challenges. Have you left your run too late with this?
Certainly, just prior to Christmas, it is a challenge. We don't believe we've left our run too late. We've certainly been advocating for this program when we discovered our 6th and 7th cases in September and October, and it's taken some time to arrange and secure a vaccine working with the Ministry of Health. So we're experienced, more experienced than any other district health board. We've run a national campaign in 2004-05 with meningococcal B. In 2011, we vaccinated nearly 33,000 children with meningococcal C. No other DHB has had these challenges at a local level like we have, and so we're hopeful that we can get up to 80% to 85% of our target population, which is 13 to 19-year-olds and 0 to 4-year-olds, or 9 months to 4-year-olds, prior to Christmas. So 3 weeks is a real challenge, but we're really hopeful that we can do that, and we've ramped up and planned for a whole lot of community centres where we'll be vaccinating 7 days a week.
So, Dr. Chamberlain, you mentioned the age groups there. People will be wondering why the kids in the middle there are missing out. What's the logic?
Yep. Yeah, and I've got a child in the middle myself, and so I understand that sense. So basically it has been a risk assessment based on the availability of vaccine at this time. We're still hopeful that we'll be able to continue and vaccinate the whole population as more vaccine becomes available.
So it is an issue of resources. Just to be clear, sorry to interrupt you, but it is an issue of resources in part. You just don't have enough vaccine to go around, can't get your hands on enough of it.
That's correct at this stage, yes. So we're aware of other places where there is more vaccine around the world, so I think the opportunity to get and secure more, we hope that will be able to be done, but initially we will only have the 20,000 doses. And if you think about the logistics of vaccinating 20,000 young people in what is less than a 3-week period, it's unlikely we could vaccinate more than that in that time. So I think the last program we undertook, it took 10 weeks to vaccinate 32,000, and we thought we'd done really well with that program. So I think 20,000 over a 3-week period is a big ask, and if we achieve that, that would be the maximum that we could achieve in that time frame. Then young people go on holiday, etc., so we probably have to regroup early in the new year.
So that number of vaccinations that you have available to you, 20,000, will that do the entire age groups, the 9 months to 4 years old and the 13 to 19-year-olds, or will some kids within those age groups miss out as well?
Look, we're going to ensure nobody misses out, but we have 24,000 in that age group, and we're estimating that we probably over that period will only be able to reach around 80% because... So
you do have more kids in those age groups? You actually do have more kids in those age groups than you have vaccinations?
We have 24,000 in those age groups, so slightly more. But, if you look at the history of vaccination in Northland, we have people who will refuse to vaccinate even with this sort of condition and the risks there, and there will be others who will be hard to reach or will have gone on holiday and we can't contact.
Right.
So there will be, I think, an opportunity for a mop-up and further vaccine available, which we must be able to access. So I can't... Sorry. Yeah.
Even in your ideal scenario, you cannot vaccinate all of these kids because in the age group specified, because you're 4,000 vaccinations short. You're relying on people not turning up or not wanting them.
The experience we've had, even with the last vaccination program, there were over 40,000 children, and it was with meningococcal C. There were more cases than this, and the same number of deaths in Northland, and we were only able to vaccinate 33,000, which was around 80, just over 80%. So again, it's not just I guess it's very likely that we still won't manage to vaccinate everyone, and some people will either refuse or be unable to be accessed prior to Christmas. In a 3-week period, I think we'll be doing incredibly well to get through 20,000. And then I'm very hopeful if there are children requiring vaccine that we will be able to access more. And I don't know if we'll even be able to access more before Christmas.
So what guarantees are there regarding the availability of vaccine? Has the government give you an undertaking that it will get more if it becomes available, and where from?
Yes, I was speaking to the Director General today. Not sure where we're from, but they are looking at whether they can access more vaccine. The other thing is, of course, other regions may have an issue around an outbreak. Northland's obviously first, but there's certain criteria which have to be reached before it justifies a vaccination program. All I'm focusing on is Northland, and I'm thrilled that we have this opportunity to vaccinate, because really that's the only effective public health prevention. And so for us, we're just focusing on achieving that 20,000.
I know Northland is your area, but ideally, would you like to see this spread to other regions?
Look, absolutely, if they have similar levels of disease, and I guess the prevalence, and we look at the history with meningococcal W, it can become quite a problem internationally. It has, so I think that's a decision for the Ministry of Health and the team, and if it's the right thing to do, I absolutely support any other regions being given the same opportunity we have. So, you know, it really depends on what happens over the next little period, but the issue is, for the whole of New Zealand, there just isn't enough vaccine worldwide, and it is in short supply. So
all right,
there will be places where it does need to be prioritised.
Thank you for joining us. That is Dr. Nick Chamberlain, who's with the Northland DHB, talking there about this vaccination program that's going to be rolled out, a limited vaccination program.